So they have it all wrong. Maybe you have it all wrong. We'll find out today as I go through this video, but it's about nasolabial folds, the lines around the edge of the mouth and to the nose. I am going to show injections today, but I'll give you a warning and you can skip over them easily. And we're going to talk about things in clinic, but also things that you might be doing wrong and what you can do at home for these folds. And they're one of the first signs to age people, or at least you're coming into your clinic saying this is aging me. But we have it all wrong. And one of the biggest reasons we do is because people are asking, I want this filled, doc. Can you just fill this up? And the problem becomes they then get this filled up and it doesn't look right. It doesn't last. It doesn't solve the problem. And to make matters worse, this isn't even where the problem is, as I'll go through with you today. The first thing you have to understand is, why did this happen? And there are four main reasons. Number one, there's a fat pad in the midface called the deep medial fat pad. And as we lose fat here, we get sag. So we'll talk about that, but that's number one. Number two is a loss of collagen. So we know now about collagen banking, and we know how we lose 30% of collagen between the age of 45 to 55, especially for females. The graph gets steeper. But there's many people coming in with lines in their 20s that they want filled. Why is that? Partly because of glycation, diet, and sugar sag. Regardless, it's a loss of collagen. I have many videos on that. And keep in mind, even if you address the nasolabial fold, you have to have balance to the face. A lot of people lose lip volume if you're getting these nasolabial folds. So often you have to also address the lips, the temples, the under eyes, and the jawline. So it's not one thing. Number three, which nobody thinks about, it's bone. You see, there's something here called the piriform fossa. So if you look at a skull, if there's an opening in the center of the skull, but then there's a piriform aperture, and at the edge here, as that bone resorbs, and it's happening at a younger and younger age, then we get retraction here, and it changes even the lip shape, and you get lip lengthening and nasolabial folds. It's why many people also go for a lip lift at the same time. So the third one, therefore, was bone. At the end, I'll give you a video on a DEXA scan so you can get your bone measured. But let's go to number four. Shifting of the fat pads. Not a lot of people think about shifting of the fat pads, and some of the fat, there's a fat pad here called the nasolabial fold fat pad. It's a superficial fat pad, but as that fat grows, it makes the nasolabial fold look deeper. Now, when we fill here, which one of those four things did we address? Zero. So let's first talk about what you're going to do at home. You're going to focus, therefore, on lifting, tightening your facial fat pads, and thickening your skin, your dermis. So that includes, number one, an AHA, an alpha hydroxy cream. The AHAs are usually going to come also with a BHA, a beta hydroxy acid in them. They're combinations. Number two, you want a powerful collagen builder as a topical. I recommend peel pads. So retinol peel pads. You can use your retinol cream, but here you're going to need to step it up for most people. So go to your peel pads. Number three, you want to help your fat pads. So this is twofold. Number one is going to be a cream with volufiline, which helps your facial fat pads, and you can just apply it here. Sometimes these are a little more expensive creams, but remember, you're going to use them where you want to plump your fat a little bit, and they're going to last you a long time. A good one will last you a long time, especially think about it. Most people are going to use it under the eye, nasolabial folds, and along the chin area. And the fourth thing you're going to do is your at-home device. These are more and more popularized. The easiest one and the most cost-effective one is going to be red light therapy, because it's known and studied to help your facial fat pads, help dysregulation of fat pads. I have a complete video I'll put up here on red light and facial fat pads. Now, you could choose RF. I like RF. You'll find about 10 or 20% of you will say It got rid of my fat. I was more gaunt. And that's not what we're trying to do, especially in this area. We are looking for the lift effect.
Here is a NUA device. This is one of many I'm playing with. I'm measuring the temperatures, the depth, see what safety mechanisms are in these. If you're using this or others, comment below and wait for my video on these. I'll explain more. I'll tell you if they're worth it, which ones, and what is the risk to your face fat.
And so RF and Galvanics can provide a little lifting effect. But again, there's a percentage of you will lose some facial fat pads. So it becomes a little unpredictable, whereas red light helps increase mitochondrial function, increase your fibroblast cell function. And that's going to do what? Two things. That's collagen and elastin. It also helps boost up your growth factors, which are cell signals. Vascular endothelial growth factor, fibroblast growth factor, those all help your skin thicken and give you lift and help your fat pads. Now, your biggest mistake in clinic is coming in and going, "Doc, I want to fill right here." Now, you might want to fill. Fillers can be good, but where do you want to be filled? Well, I said we need to address the what? Deep medial fat pad. That's here. Most people are losing mid-face volume. The problem is a lot of men look a little bit better with a flattened section here, so you can't overfill it. And for women, if they carry a bit of weight and they get too much only addressing the front, they can feel like they look like they're carrying more weight than they are. So sometimes you have to be careful here and fill it a little bit.
So fast forward about 45 seconds if you don't want to see any needles, but here I'm demonstrating a microcannula injection of hyaluronic acid filler with Restylane Lift. Now she's just had filler in her lips, she's swollen. She just had mid-face filler, so we optimized that, but we didn't want to add too much in the mid-face, so I'm addressing that fold. Again, everything's a little distorted here because of the swelling, but the nasolabial fold is the very last place I'm going, and that's the key. Now I'm using a microcannula. Why? Well, the facial artery comes up right through here. And when you dissect the face, the problem is the vessel is exactly where we want to be with the filler. So you have to be very careful. Any filler in this area, of course, can lead to an occlusion, which isn't good, blindness, and other problems. But you can see, take your time, slow injecting. The patient has pretty much zero discomfort, and it will all settle in 100% perfect.
Your options are fillers, but better yet, biostimulators. So you think of things like PDRN or Rejuran in many countries. You think about people use some exosomes. Better yet, your own exosomes and growth factor with something like platelet-rich fibrin or Plasmafil. The good news here, also you can take care of the lateral cheek here. That will give you a little bit of pull. Now, you're going to say, Rajani, what about PDO threads? Yes. Now, there's a lot of FUD about PDO threads. PDO threads are thread lifting, where you're using a thread. You're putting it most commonly from the lateral portion of the face. You're putting it in. They're about 4 inches long, and you provide a lift. You have to be the right candidate. You can't have too much skin laxity. You also, most importantly, have to find a great injector. Not everyone can place threads, and you might say they're painful. They're not really painful in those who do them a lot, because we can put little bits of lidocaine along the track by injecting them. I have videos on exactly how to do that.
Okay, here's a little treat for you today, but if you don't like seeing injections, skip forward about a minute and a half. I'm going to show you a nasolabial thread being placed. This was of a complete case of a 3-point lower facelift, and I'm using PDO, polydioxanone threads, and I'm going to use molded threads here. Now here I'm using lidocaine with epinephrine, and here is the thread. But notice the patient is not 40 or 30, she's over 60. She's still a candidate because there's not that much loose skin. And what I'm doing here is advancing it, but look where my hand is, I have a syringe with anesthetic. And I can drip a little bit of anesthetic in as needed. Now, I'm going through some osteocutaneous ligaments. I'm taking my time. I'm looking for my path. I'm moving the tissues over the cannula. This is a 4-inch, again, molded thread. These are not barbed. I want more lifting, and these are solid. They're going to last here a year or a year and a half. And you can see I'm just going to the nasolabial fat pad that we talked about. and making sure I get it right in that fat pad, because when I remove this thread, as I'm going to do in a moment here, I want the end of that thread right in that fat pad so I can lift it. Now I partially set that thread, but here you can see I set it a little bit more before I go on to the next threads, and that provides that lifting. PDO threads are going to make a comeback. It's just that you need a skill provider and the right candidate.
But PDO threads, you're going to repeat them probably every year to 18 months. A full thread lift is about $2,500 to $3,000, but for just lifting a couple threads is more like under $1,000. So if it's just nasolabial folds, you can use some threads well, but you need to have real threads with a real provider, and you can't have too much sag, but I do like that option for lifting. Now, what about that darn bone loss we talked about? Well, keep your bone, vitamin K2, D3, measure your bone with a DEXA scan. I'll put a video at the end here. You also want to think about filler placement, or better yet, biostimulator on the bone. We have Sculptra that's FDA approved now for injection on the bone in this area and in that lateral cheek I talked about.
Okay, I'll show you this now. So fast forward 30 seconds if you don't want to see a needle go in, but this is where I'm using Sculptra. You can see it's quite cloudy in the syringe. This is hyper concentrated. Now, again, you want to have done a lot of these before you use hyper concentrated. I pull back on the plunger, make sure I'm not in a vessel, because the vessel could be on bone here, and I'm using a good dose. I want to really get some projection here.
Sculptra is also FDA approved for skin tightening, so you'll get a little bit of that pullback. I have Sculptra in here and in here for myself. But you can put hyaluronic acid fillers if that's all you have or your provider provides. Biostimulator growth is like this. Not everyone has adopted it yet. Little do they know they're going to have to adopt it, because biostimulators is where the trend is going. It's all about facial fat pads in the face. Now, don't forget about what you can do at home with diet and collagen banking. Think collagen powders, vitamin A, C, E, and zinc. Eat real food, eat organic, and you can take supplements that contain these plus silica. There's more and more data on collagen powders, like this study right here that talks about absorption of collagen, because many people think, oh, well, I'll just eat more protein and get the amino acids that make up collagen. While that's good, it's been shown now that collagen powders have benefits, and there's studies showing decreased lines and folds. It's all about collagen banking. The more collagen and elastin you have, which is from a healthy fibroblast, the better you eat. Combine these treatments that I talked about, and your nasolabial folds will be addressed. Now, I want you to comment below what's worked for you. Here's a video where I talked about collagen boosting with collagen powder, and one down here, exactly how to use LED light to create lift, build collagen, and keep healthy fibroblasts. Keep your skin and body beautiful, healthy, and vibrant.